If you wake up with dry mouth, your body is warning you. Almost nobody knows this. Consider these serious health concerns: poor circulation, significant memory loss, and even the grave reality of heart failure. It might seem surprising, but all of these profound health issues can trace their origins back to something as seemingly minor and commonly overlooked as waking up with a dry mouth. Most people, when they experience this sensation, simply turn over, reach for a glass of water to quench the immediate dryness, and then carry on with their morning routines, dismissing it as a temporary inconvenience. But what if that persistent dryness isn't just about thirst? What if it's your body diligently sending you a crucial warning signal, one it might have been transmitting for months, or perhaps even for years, yet no one has ever taught you how to properly interpret it? This is the thought that consistently stops me in my tracks and prompts deep reflection every single time it crosses my mind. The reality is that chronic morning dry mouth is far more prevalent than many realize, affecting a staggering number of people. Nearly 1 in 3 adults over the age of 60 silently experiences this every day, and in the vast, overwhelming majority of these cases, it has absolutely nothing whatsoever to do with the amount of water you may or may not have consumed the night before. Absolutely nothing. Despite this significant prevalence and the potential implications, this isn't a topic that's regularly discussed in most pharmacies. It's certainly not a common conversation happening during routine annual checkups with healthcare providers. This vital information is simply not being adequately shared or understood. Please stay with me through to the very end of this discussion, because the number one primary cause I'm going to reveal to you today is something that might be sitting quietly, often unnoticed, in your very own medicine cabinet or right on your nightstand at this moment. And it has the potential to be causing far more significant damage than merely drying out your mouth. We're talking about a silent force with the genuine potential to simultaneously impact the critical functions of your kidneys, your heart, and your brain. I am Dr. Amelia Lawson, a dedicated physician with over a decade of intensive clinical experience, specifically focusing my practice on the complex health needs of adults age 60 and above. Throughout my extensive career, I have had the privilege of sitting across from countless men and women who initially approached me with symptoms they considered to be minor or insignificant. Only through careful investigation and empathetic listening did we often uncover a serious underlying medical condition that had been cunningly hiding itself behind that one seemingly small, easily dismissed symptom. Morning dry mouth fits this exact description of a deceptive symptom. On the surface, it appears disarmingly simple, a mere annoyance. Yet beneath that surface, it holds the potential to signify something truly life-changing, something that demands our attention. What I'm about to explain to you directly challenges a deeply ingrained belief that most of us have been quietly conditioned to accept over time. The notion that aging inherently means discomfort, or that a perpetually dry mouth is simply an inevitable part of growing older. I want to be unequivocally direct with you right now. That perspective is not the complete truth. And after 10 years of witnessing patients endure unnecessary suffering because this critical information never reached them, I am no longer willing to remain silent about it. If you find this information helpful and valuable, please take a moment to hit that like button right now. Your simple action genuinely helps this important message reach a wider audience, specifically the people who truly need to hear it and benefit from it. Let's delve deeper and talk about what is actually, physiologically, happening inside your body during those mornings when you wake up experiencing that uncomfortable sensation, almost as if your mouth is packed with cotton. Your mouth relies heavily on a continuous and robust supply of saliva, and it's crucial to understand that saliva is far more than just simple water. It is, in fact, an incredibly sophisticated and vital biological fluid. This complex fluid carries a powerful array of enzymes, potent antimicrobial proteins, essential minerals, and various protective compounds. Together, these components work tirelessly around the clock to defend your teeth, safeguard your gums, protect your throat, aid in proper digestion, and bolster your immune system. When the salivary glands, which are responsible for producing this vital fluid, begin to slow down their function, or when other complex systems within the body start to struggle and become compromised, saliva production inevitably declines. And when this reduction in saliva production becomes significant, your mouth will dry out, particularly during the overnight hours when you are not actively drinking, not speaking, and not engaging in any activities that would naturally stimulate the flow of saliva. It's a biological reality that after the age of 60, your body naturally produces approximately 30 to 40% less saliva than it did, for example, during your 40s. This age-related reduction alone creates a real vulnerability within your oral health. However, this situation becomes genuinely dangerous when this natural decline combines with the 7 specific causes I am about to meticulously reveal to you. This is because none of these causes merely result in a dry mouth. Every single one of them is, in fact, a signal, pointing to something much deeper and potentially more serious happening inside your body. As a clinician, here is what concerns me most deeply. Chronic dry mouth is clinically associated with a 45% higher risk of systemic infection in adults over the age of 60. Saliva acts as your mouth's crucial frontline immune defense. When this defense is diminished or removed, bacteria, fungi, and viruses gain a more direct and less obstructed path into your bloodstream, increasing your susceptibility to illness. So let's systematically go through all 7 of these causes, starting with the least serious and progressing to the one that causes me the most profound concern. By the time we conclude this discussion, you will be equipped with the precise knowledge of what specific symptoms to watch for, what questions to pose to your doctor, and what actionable changes you can implement differently, starting as early as tonight. Before we embark on this journey, I want to ask you something deeply personal. How long have you personally been waking up with the persistent sensation of a dry mouth? Has it been just a few weeks? Perhaps several months have passed? Or has it been years, a long-standing issue you've learned to live with? Please feel free to share your answer openly in the comments section below. I genuinely read every single response, and your candid answer not only helps me understand the scope of this issue, but also helps someone else watching this video realize that they are not alone in their experience. Number 7, mouth breathing during sleep. The 7th item on our list is the most common cause of dry mouth that I observe in my practice, and it is also, paradoxically, the most frequently dismissed as trivial. We are talking about mouth breathing during sleep. Before you quickly scroll past this point, perhaps thinking it's too obvious or entirely harmless, I urge you to pause and hear something critically important. Mouth breathing during sleep is almost never just a habit. In my extensive clinical experience, it is nearly always a discernible symptom of something else significant going on within your body, and recognizing that distinction truly matters enormously for your health. When you breathe through your mouth throughout the night, the constant flow of air moves directly across the delicate surfaces of your tongue, your palate, and the very back of your throat. This continuous air current acts like a natural evaporator, relentlessly removing moisture at a rate that your salivary glands simply cannot keep pace with while you are sleeping soundly. The direct result of this evaporative process is that distinct sandpaper-like feeling you experience when you wake up, often accompanied by cracked lips, a thick or coated tongue, and sometimes even a sore throat that has absolutely nothing to do with any illness or infection. But here is the aspect of mouth breathing that concerns me far beyond the discomfort of the dry mouth itself. Mouth breathing during sleep is frequently driven by underlying physiological issues such as chronic nasal congestion, a deviated septum, nasal polyps, or, most critically, undiagnosed sleep apnea. And sleep apnea, in particular, is not a condition to simply wave away or ignore. Extensive research unequivocally shows that untreated sleep apnea is linked to an alarming 60% increased risk of stroke and a significant 40% increased risk of heart failure. If you are consistently waking up with a dry mouth, and you also snore loudly, or if you consistently feel unrested and fatigued even after what you believe was a full night's sleep, or if someone close to you has ever noticed that you sometimes visibly stop breathing during the night, please do not simply file that away as just the way you sleep. This warrants immediate attention. Speak with your doctor about undergoing a sleep study. That single conversation could potentially matter far more for your long-term health than you currently realize. For individuals whose mouth breathing is not linked to sleep apnea or other serious underlying conditions, the practical solutions available are refreshingly straightforward and remarkably effective. A simple nasal strip worn comfortably across the bridge of your nose before going to bed can significantly increase nasal airflow, gently encouraging your body to breathe through your nose the way it was naturally designed to. Incorporating a humidifier into your bedroom, consistently set to maintain a comfortable humidity level between 40 and 50%, can dramatically reduce overnight moisture loss. Switching to a side sleeping position also naturally reduces the tendency to breathe through your mouth, and a small, specialized strip of surgical tape placed vertically over the lips before sleep, a technique that sleep specialists have effectively utilized for years, gently trains chronic mouth breathers back toward natural nasal breathing. Many people report noticing a real and tangible difference in their comfort and dryness within the very first week of implementing these simple changes. Number 6, mistaken nighttime hydration. Number 6 addresses a mistake I observe being made most consistently, and it is an approach that feels entirely logical and intuitive until you genuinely understand the precise physiological reasons why it simply does not work as intended. Most people who routinely wake up with a parched, dry mouth naturally assume that the straightforward fix is to drink more water right before they go to bed, so they do exactly that. They often consume a large glass of water just moments before turning off the lights and settling in for the night, only to wake up the next morning feeling just as dry as before. Sometimes they even feel more frustrated because they diligently followed what seemed like the correct advice, yet nothing about their condition changed. Here is the crucial reason why this approach is ineffective. Your body does not hydrate in real time. When you drink water, it takes a considerable amount of time, typically between 30 minutes and up to 2 hours, for that fluid to be properly absorbed into your bloodstream, distributed effectively to your various tissues, and then made available for essential bodily functions, such as the production of saliva. Therefore, water consumed at 10 sak at night is actually doing very little, if anything at all, to hydrate your mouth at 6 nas the next morning. The crucial window for its beneficial effects has already closed by then. The real problem lies in what happened, or more accurately, what didn't happen, earlier in the afternoon. Research has compellingly found that adults over the age of 60 who did not maintain an adequate and consistent fluid intake between noon and 4 hours in the afternoon were a significant 62% more likely to experience considerable overnight dry mouth compared to those who remained consistently hydrated throughout the entire day. A 62% difference is by no means a small or negligible statistic. It represents a substantial impact. And after the age of 60, managing this becomes inherently harder to regulate naturally because the body's natural thirst mechanism becomes genuinely less reliable and sensitive with advancing age. You can actually be meaningfully dehydrated and yet feel no particular urge or sensation of thirst to drink water. Furthermore, many individuals quietly reduce their afternoon fluid intake to minimize nighttime bathroom trips, which is a completely understandable desire, but it inadvertently creates a hydration deficit that peaks precisely when you have no effective way to correct it. The genuine solution is not to drink more water excessively at night. Instead, it is about strategically front-loading your hydration earlier in the day. Aim to consume 6 to 8 ounces of water with every meal and with every afternoon snack you have. And here's a small but surprisingly effective professional tip. Consider adding a tiny pinch of sea salt and a small squeeze of fresh lemon to your afternoon water. This simple addition helps support your electrolyte balance, which in turn assists your cells in actually holding onto the fluid you consume, rather than allowing it to pass straight through your system without being properly utilized. Number 5, nutritional deficiencies. Number 5 is a cause that catches almost everyone off guard because we rarely, if ever, consider nutrition as a direct and immediate cause of something as specific as a persistent dry mouth sensation occurring every single morning. However, the connection is profound. Your salivary glands are not merely passive structures simply existing in your mouth. They are, in fact, metabolically active tissues, highly dynamic and essential, requiring specific and consistent nutrients to function properly and efficiently at the cellular level. 2 particular nutritional deficiencies can severely impair salivary gland function in adults over 60 more rapidly and profoundly than almost anything else. The first crucial nutrient is vitamin A. This vitamin is absolutely essential for maintaining the overall health and structural integrity of every mucous membrane throughout your entire body. This includes the delicate lining of your mouth, your throat, your nasal passages, and even your extensive digestive tract. When vitamin A levels fall below optimal, these vital membranes become thinner, drier, and progressively less functional, directly impacting saliva production. Research has demonstrated that adults over 60 with low vitamin A levels showed a significant 41% reduction in resting saliva production compared to those with adequate levels. This is not a subtle effect. It indicates that your salivary glands are operating at merely a fraction of their potential capacity due to this deficiency. The second group of critical nutrients are the B vitamins, specifically focusing on B3, also known as niacin, and B12. Niacin deficiency directly disrupts the intricate nervous system signals that are responsible for triggering saliva production in the first place. A B12 deficiency, on the other hand, causes the tongue to become inflamed, abnormally smooth, and persistently dry, a noticeable condition clinically referred to as glossitis. Together, these deficiencies create a dry mouth condition that no amount of water will fully resolve, because the underlying problem isn't simply a lack of hydration. It is a fundamental issue with cellular function within the salivary glands themselves. After the age of 60, the absorption of B12 notably drops, primarily due to a reduced production of stomach acid, which is necessary for its uptake. Research suggests that up to 30% of older adults may have inadequate B12 levels without any awareness of it whatsoever, making this a silent yet significant issue. For dietary sources, make an effort to focus on foods rich in vitamin A, such as sweet potatoes, vibrant dark leafy greens, and eggs. For B12, prioritize lean meats, various types of fish, and dairy products. For many adults over 60, supplementation becomes a necessary and prudent step to ensure adequate levels. Look for a B-complex supplement that contains at least 1,000 micrograms of B12 in its methylcobalamin form, which is widely recognized as the most bioavailable and easily absorbed version available. And one practical professional tip: vitamin A is a fat-soluble vitamin, meaning it absorbs far more effectively when consumed alongside a small amount of healthy fat. A light drizzle of olive oil over your vegetables or a few slices of avocado with your meal can make a genuine difference in its absorption and effectiveness. Number 4, dry mouth and nighttime urination, blood sugar warning. Number 4 represents a combination of symptoms that I take most seriously in my medical practice. And if this particular pairing applies to you, I want you to hear this message with utmost clarity, not with fear or alarm, but with the empowering understanding that knowing early truly is everything when it comes to health. If you are consistently waking up with a dry mouth, and you are also finding yourself getting up to urinate more than once during the night, that specific pairing of symptoms is a potent clinical warning flag that I simply do not ignore. Together, these two seemingly disparate symptoms are among the earliest and most subtle signs of uncontrolled blood sugar levels, and in many significant cases, they can be indicative of undiagnosed type 2 diabetes. Here's the precise physiological mechanism behind this connection. When blood sugar levels climb above a certain healthy threshold, your kidneys have to work overtime much harder than usual to filter and excrete the excess glucose from your system. To accomplish this demanding task, the kidneys draw essential water from your body's other tissues. This internal fluid loss, in essence, dehydrates you from the inside out, and one of the very first places you consciously feel this internal dehydration is in your mouth overnight, particularly when there is nothing you can actively do to compensate for it while you sleep. What makes this particular symptom combination so critically important is its timeline. Research has definitively found that morning dry mouth was reported by a striking 63% of adults who were newly diagnosed with type 2 diabetes. Even more significantly, most of these individuals had been experiencing that specific symptom for over a year, sometimes much longer, before they finally received their diagnosis. This means over a year of their body diligently signaling that something was profoundly wrong every single morning, without that signal being properly understood or acted upon. I am reminded of a particular patient of mine, a vibrant retired woman in her early 70s who was sharp-minded and very active. She initially came to me for an entirely unrelated health concern. Almost as an afterthought, as she was preparing to leave my office, she casually mentioned her persistent dry mouth. I then proceeded to ask her a few targeted questions. Was she waking at night to use the bathroom? Yes, she confirmed regularly. Was she experiencing unusual afternoon fatigue? Yes, she affirmed. Based on these subtle clues, I immediately ordered a fasting blood glucose panel for her that same week. Her result came back at 148 milligrams per deciliter, unequivocally indicating type 2 diabetes. She had been living with this condition unknowingly for well over a year. Within just 4 months of implementing targeted dietary changes, incorporating daily movement, and supplementing with berberine and magnesium glycinate, her fasting glucose levels had completely normalized. At her follow-up appointment, she told me, with a profound sense of relief, "I finally feel like my body is working with me again." That is precisely what catching something early looks like. It's not a crisis, it's a powerful opportunity to regain control of your health. Number 3, Sjögren's syndrome. Number 3 on our list is a chronic autoimmune condition that affects approximately 4 million Americans. And yet, the average patient often waits nearly 3 agonizing years from the moment their initial symptoms begin to the moment they finally receive an accurate diagnosis. 3 years. This isn't merely a small gap in medical knowledge. It represents a significant and frustrating gap in the essential conversations that should be happening inside examination rooms between patients and their healthcare providers. The condition is specifically called Sjögren's syndrome. It is a chronic autoimmune disorder in which the body's immune system, normally designed to protect against foreign invaders, mistakenly targets and attacks the body's own healthy, moisture-producing glands. Primarily, it focuses its attack on the salivary glands, leading to dry mouth, and the tear glands, resulting in dry eyes. The unfortunate result is a persistent and often severe dry mouth, chronic dry eyes, significant difficulty swallowing due to reduced saliva, and in more advanced or severe cases, systemic involvement. This can include debilitating joint pain, overwhelming fatigue, and even adverse effects on vital organs such as the kidneys and lungs. It's important to note that women over the age of 60 are disproportionately affected by Sjögren's syndrome, representing nearly 90% of all diagnosed cases. So why does it take so exceptionally long to accurately identify and diagnose this condition? The reason lies in the fact that each symptom often gets treated in isolation, as if it were a separate, unrelated problem. The dry mouth is frequently dismissed as an inevitable sign of aging or simply due to dehydration. The dry eyes are often attributed to excessive screen time or seasonal allergies. The joint pain is commonly labeled as arthritis. No single doctor, without a comprehensive view, connects these seemingly disparate dots, and consequently, the underlying autoimmune process continues unchecked and causes further damage the entire time. The crucial diagnostic clue I want you to carry with you, and to remember clearly, is this. If your persistent dry mouth is consistently accompanied by eyes that feel chronically dry, gritty, or have a burning sensation, and particularly if you are a woman over the age of 60, please ask your doctor specifically about Sjögren's syndrome by name. A straightforward blood test, which measures the presence of two specific antibodies, anti-SSA and anti-SSB, can reliably identify the condition in the majority of cases. You are absolutely entitled to ask for that specific test. Do not wait for someone to offer it to you. Proactively request it. While there is currently no definitive cure for Sjögren's syndrome, there are highly effective treatments available that can significantly manage symptoms, alleviate discomfort, and importantly, slow the progression of the disease. And for immediate temporary relief while you are actively seeking answers and diagnosis, sugar-free gum containing xylitol is one of the most accessible and beneficial tools available without a prescription. It effectively stimulates saliva production and simultaneously inhibits the growth of decay-causing bacteria that dry mouth unfortunately encourages. Number 2, autonomic nervous system dysfunction. Number 2 on our list is a cause that most people would likely never connect to a dry mouth, but the link is absolutely real, thoroughly documented by medical science, and every adult over the age of 60 genuinely deserves to be fully aware of it. Your salivary glands do not operate independently in isolation. They are intricately governed by your autonomic nervous system, specifically the parasympathetic branch, which is the system responsible for overseeing the body's crucial rest, recovery, and digestive functions. When this delicate system becomes compromised or dysfunctional, salivary activity naturally declines, and as a direct consequence, the mouth dries out. What makes this particular connection so profoundly significant is that autonomic nervous system dysfunction is a recognized and often early feature of developing Parkinson's disease and Lewy body dementia. Crucially, research has shown that these subtle autonomic changes can appear as much as 4 to 6 years before the classical motor symptoms, such as tremors or rigidity, that typically lead to a diagnosis become apparent. I recall a patient of mine, a thoughtful, retired man in his late 70s who was naturally methodical and quietly observant. He had mentioned a persistent dry mouth across several visits to my office. We had systematically worked through all the obvious explanations, reviewing his medications, discussing his sleep position, and ensuring his hydration was adequate. Despite our efforts, nothing fully resolved the dry mouth. Then, during one routine appointment, his wife mentioned, almost in passing, that he had stopped recognizing the distinct smell of his morning coffee. He had noticed it too, but had said nothing, assuming it was an unrelated and minor change. It was, in fact, far from unrelated. This subtle symptom, coupled with the persistent dry mouth, prompted me to refer him immediately to a neurologist. Imaging tests subsequently confirmed early Parkinson's disease. He was understandably shaken by the diagnosis, but precisely because we found it early, he was able to begin neuroprotective therapy and collaboratively build a comprehensive care plan well before any significant motor symptoms had fully developed. 3 years later, his quality of life remains genuinely good and fulfilling. He told me at a recent visit, with a touch of regret, "I almost didn't mention the dry mouth. I truly thought it was too small and insignificant to bring up." This patient's experience underscores a vital lesson. Nothing is too small or insignificant to bring up with your doctor. Your body is perpetually communicating with you, sending signals. Our collective job, yours as the patient and mine as your physician, is to learn how to effectively listen to and interpret those communications. Number 1, the overlooked medication side effect. Number 1 is, without a doubt, the cause I encounter most frequently in my medical practice, and it is also the one that is most consistently overlooked, most poorly communicated to patients, and in my professional opinion, most deserving of a direct, honest, and urgent conversation. Over 500 commonly prescribed medications list dry mouth as a known side effect. That's right, over 500 different pharmaceutical drugs. For adults over the age of 60, who on average take 5 or more prescription medications daily, the cumulative impact of these drugs on salivary function, and importantly, on overall brain health, can be truly profound and deeply concerning. The drug classes most frequently responsible for inducing dry mouth include widely used medications such as antihistamines, various antidepressants, numerous blood pressure medications, bladder control medications, antipsychotics, and certain pain medications, including common muscle relaxants. What makes this situation genuinely dangerous is a complex but crucial concept known as anticholinergic burden. This refers to the cumulative neurological effect of taking multiple medications that all work by blocking the action of acetylcholine, which is a vital neurotransmitter essential for many bodily functions, including memory and muscle control. High anticholinergic burden has been robustly linked in multiple large-scale scientific studies to accelerated cognitive decline and a significantly elevated risk of developing dementia. The dry mouth, in this context, is not merely a superficial endpoint or an annoyance. It is a clear, visible signal of something much deeper and more concerning happening within your neurochemistry. I remember another patient, a retired man in his mid-70s, who vividly described waking up every morning feeling as though he had swallowed chalk. He had been on the same combination of medications for many years, prescribed by various doctors over time. No single prescribing physician had ever comprehensively reviewed his full medication list together to assess for overlapping effects. A thorough medication reconciliation, a careful review of all his drugs, identified 2 specific medications with significant overlapping anticholinergic effects, both of which, thankfully, had safer and equally effective alternatives available. We made just 2 careful substitutions in his medication regimen. Within weeks, he began to notice a palpable difference in his mouth's dryness. Within 2 months, he told me, with immense relief, "I wake up feeling like a normal person again, and my thinking feels sharper than it has in years." That remarkable improvement was no mere coincidence. It was a direct result of addressing the underlying anticholinergic burden. Here is your actionable plan, starting tonight, to address potential causes of dry mouth and improve your overall health. 1. Eliminate over-the-counter sleep aids. Stop taking any over-the-counter sleep aid that contains diphenhydramine, a common antihistamine with significant anticholinergic effects. Melatonin, in a low dose of 0.5 to 1 mg, is a far gentler and more natural alternative to consider for sleep support. 2. Optimize bedroom humidity. Run a humidifier in your bedroom, maintaining a comfortable and consistent humidity level between 40 to 50% throughout the night. This will dramatically reduce moisture loss from your mouth and nasal passages. 3. Front-load hydration. Strategically front-load your hydration by consistently drinking adequate fluids through the afternoon hours, rather than trying to compensate with large amounts of water right before bed. 4. Oral hygiene for dry mouth. Before bed, brush your teeth with a fluoride toothpaste specifically formulated for individuals experiencing dry mouth. These products often contain ingredients that help retain moisture. 5. Consider a nasal strip. Try wearing a nasal strip tonight. This simple device can significantly improve nasal airflow, encouraging you to breathe through your nose and reduce mouth breathing during sleep. 6. Medication review with your doctor. This week, make a comprehensive list of every single medication you take, including prescription drugs, over-the-counter remedies, and any supplements. Bring that detailed list to your doctor. Ask them directly, do any of these medications suppress saliva production, and are there any safer, equally effective alternatives available that might have fewer side effects? You are not broken. Your body is incredibly resilient. Your information has simply been incomplete, and understanding the full picture is key to making informed decisions about your health. And starting right now, that changes. If this video has been helpful and insightful for you, please show your support by smashing that like button. Consider subscribing to this channel for more genuinely real health solutions that are specifically built and tailored for adults over the age of 60. And most importantly, please share this valuable information with someone you genuinely care about, a friend, a family member, a spouse, or anyone who might benefit. You may just be providing them with that single crucial piece of information that has the power to change everything for their health and well-being. Finally, I truly want to hear from you. Which of these 7 causes surprised you the most? Which one made you pause and think, that might actually be me? Share your answer and your story in the comment section below. I genuinely want to know your personal experience. Because remember, aging does not inherently take away your body's amazing ability to recover and heal. It simply serves as a powerful reminder to care for it in the right way, with the right information. Take good care of yourself,